Just not done.
Oh, I just put an elastic around it.
Okay.
Should be a full deck.
Yeah.
Unless someone's taken something.
I know there's one at the back that says it's not full, but
I'm done. I'm sitting.
Okay, guys.
All right.
Take it away.
Oh,
yeah, I was going to ask you.
Yeah, just before we're going to switch into a couple other topics. And before I do, I just want to pause here and see if there might be some questions around anything Beth and I have shared so far. So I'm thinking about the policy, the work we do. Yeah.
I had a couple of questions.
Go for it.
And while people think of the question, one question would be, it's interesting that you were spending all that time internally adding pressure to pressure Island Health to create a policy for the 30,000 odd employees. Were you given a directive by your immediate boss to do that, or were you doing it off the side?
Oh, I absolutely off the side of the desk. And of course, she was supportive. So she said, put it to paper because I was frustrated. And so when I put it to paper, I would start with like a draft, and then I would send it to people. And, people would reach out to harm reduction and say, don't we have something? I said, oh, well, I have this. So, if you think we need this, say something. And so then people would give a bit of feedback, and that version turned into version 8. And that was the joke, that it was a V8, good for you, Juice. We need to do this. I know, just a little humor.
You guys are so young.
Anybody know what a V8 is? Okay. And so, yeah, there was, I would find allies, and they're like, oh yeah, okay, yeah. So people were like, staff were craving that we needed this. And I just had to take the staff and connect it with the larger leadership.
That's what perplexes me. You would have overdose prevention services, harm reduction services. They would have procedures for themselves. But Island Health writ large, as the health authority, did not have a policy.
Did not have a policy related to harm reduction and substance use. It was clearly a gap, and we needed it.
A lot of those community agencies aren't under Island Health either. But
mental health and substance use, the Harbor, OAT, the Rapid Addiction Medicine Clinic.
So were they just saying, oh, it's good enough, we just follow the CDC, we just follow maybe the ministries?
Oh gosh, you just tweaked something for me. So when I first was, when I was trying to promote this, someone took, I see your hand up, sorry. It's okay, just if I get, remind me. Someone said, oh, well, the BC CDC has a statement on harm reduction. Maybe as an organization, we should just adopt that. And I'm like, I don't think so. I think as an organization, we have to actually do some work around understanding how this influences us. We adopt a statement and we say, hey, we believe in this, but that's been created by someone else. That's not owned by Island Health. And in that scan of looking for who has harm reduction policies, hardly anyone did. Providence did, but no other health authority did.
That's what I find shocking, that in 2018, Vancouver Coastal Health, for example, which would have been very integrated into Portland Health Society, inside the first safe consumption site that would have been exempt from criminal prosecution on Hastings. The other OPSs that had opened up by 2016, that it opened. That they also didn't. Vancouver Coastal Health Authority did not have a policy.
No. First Nations Health Authority did in 2021. Yeah. So it was interesting. All that work that we did, other health authorities are like, because we're all connected, are like, you've got that passed. Can you share your policy? Can you share the briefing note that you shared with executives? So then I had all these resources that I could say, yeah, here, go for it. So now most other health authorities have a policy that was honestly fashioned after the work we did.
I think Northern Health is the only one that doesn't still, or
I don't know.
Yeah, I don't think they're completely there yet.
Yeah. So Fraser Health did not.
Nope.
Vancouver Coastal Health.
No.
North Island.
Nope. North, not North Island, Northern Health.
Northern
Yeah.
Health, sorry,
Yeah.
I misspoke. And then Island Health would be the first, if we don't count first.
Yeah.
Oh, wait a second. Okay.
Yeah. So sorry. Here and then.
Would you say that like BC policies around this is more progressive than the rest of Canada? I'm from Alberta, and
Oh, I'm sorry.
yeah,
Ooh.
the it's bad like right now.
Yeah, it's bad.
Some of the
Yeah.
policies that are going through. Like, that BC is more progressive than the rest of Canada.
I would.
Yeah.
I would. You're gonna say something?
Alberta's spending a lot of money. That was one of the sessions I went to when I was at the conference, and they're spending a lot of money and for people to go to treatment, but they want those people to stay abstinent, right? And that's not something that we push, I guess you could say. I mean, it works for some, it works for me, but it doesn't work for everybody. And I don't think anybody should be forced to do anything that they're not ready to do, right? I mean, our biggest, I think, there's a lot of people that probably want to get sober. Just another thing I want to just back up. I don't say clean because that implies I was dirty at some point and I wasn't. So I say sober.
Language matters.
Language
There's
does
an
matter.
example.
It matters a lot. But yeah, I don't even know where I was going. I lost my train. But.
Yeah. I would say we are more progressive, but there are other places that are coming along, places that we can also learn from. And I would also say we have a long way to go.
Yeah. Newfoundland, when it comes to working with peers, Newfoundland's way ahead of us. They have a whole program. They have a whole organization that deals with peers, and you go to them and you want to learn more about how to work with peers. They will bring their organization into yours and teach you. They will suggest peers. They will support you through the whole thing. So it's exciting.
Is that the health authority?
No.
Oh, okay.
That's just different.
Yeah. And I'd say the health authority is learning about best practices for peers. We've got lots of great organizations that are peer run, that work really well with peers, who have relationships with people who use substances. This is a learning curve for Island Health. Yeah. I'd say there was an uptake for Island Health to run an overdose prevention services in acute care. So a lot of, like Mike was talking about, like supervised consumption sites where people can be witnessed, often get contracted out to organizations rather than the health authority doing it, because there's a lot more flexibility when a community service provider does it. And I would like to say that most community service providers have better relationships in the community with people that are requiring support. Yeah. So, so when I talk about not working well, it's really within Island Health. And it wasn't even working well. That wasn't even the issue. It just was no will around wanting to explore that service. Yeah. Yeah. So, yeah, I'm trying to think of what would be an example. So in the policy, there is a statement that I am so glad it's in there, which people would have tried to get out. Bear with me.
What's it about?
Abstinence is not a condition. So if
This is all going to have to change. Decrim's going to have to come out of here.
Yeah, well.
It's under 1.5. It's under the second bullet.
1.5?
That's decrim. No.
Oh,
I was just saying decrim's going to have to come out now.
and so it's somewhere in here. It's about abstinence. Yeah. So sorry, Mike.
It's also recognized that some people will continue to access but blah blah blah. Is that what you're looking for?
That abstinence isn't a requirement of care.
Yeah.
Yeah. So that has saved us. And here's a really good example of how this policy that's in place supports people to think about what they're having in terms of their own documents. So I get a cold call out of the blue. This was just a couple weeks ago. Hey, we have this, do you have time to talk? We at our quality council in this other area, they have a document that they want us to review. It's called Prohibition of Substances. I'm like, pardon me? That was the title of and she's like, they want to not allow people into service who have a history of using substance history or current use. And I'm like, well, okay. And she's like, what do I do? And I'm like, okay. So get the policy. So when you're talking at the table, you can say, hey, this is not in alignment with the harm reduction substance use policy. And I said, I'm trying to get another document passed called, help me out, Beth. It's a procedure document about how to dispose of substances in community. Okay. So if someone relinquishes substances or someone forgets their substance, which is unlikely, what do you do with it? How do you dispose of it in a safe way? Because you always have to have procedures and safety. And I said, for me to get that procedure passed, I have to go to all these, those circles, those quality councils to say, hey, how do you like me now? You have to do that with your document, and you tell them they have to come to the Addiction Medicine Quality Council. And we'll have something to say.
Oh, yeah.
So this is good inoculation to stop bad practice.
Sounds very bureaucratic.
Oh my God, it's killing me. Yes, it is. Yes.
I just have a question about educating people. I'm also from Alberta, and there's a lot of things I didn't realize. One of the videos I was watching before class was that one of the guys down at Pandora that was struggling. He was saying that there's a stereotype that a lot of people think that weed is a gateway, but in reality it's trauma.
Yeah, 100%.
And I was just thinking, if you implemented some of these talks, maybe in high schools or something like that, where I'm from Calgary, and I didn't think about anything like that before. Maybe I would have a different opinion to Victoria. I would already know these things. Because, I was just wondering, do you guys go to high schools at all, or is that something you think about? Because from being from Calgary, I've not thought about anything like that. And especially being on the street downtown, people that are drunk or whatever, and how they treat the homeless population. I mean, at least compared to
our unhoused neighbors.
Yeah.
Yeah, great question. So we do have some support for schools, but when you think there's only 4 of us, 5 on the island, we provide supportive, I'd say, consultative roles. So we have a healthy schools team, and so Jenna, my colleague, supports the healthy schools team. So when there was a ministerial order that was released related to schools needing to have naloxone on all the school property.
By the end of this year.
Yes. So then Jenna supports our healthy schools team about how is that going to look? How are people going to get trained? And then what about education and information? So Jenna supports those teams to be able to have conversations in the schools.
And we're looking at, and I think personally that we should be doing it younger. I think we should be starting in middle school where we're not. We're starting at the high school level. Because in August we had a 13-year-old kid pass away in Souk. 13 years old. This doesn't have to happen, right? If we're not, we need to be educating our kids, and they're getting younger and younger. My grandson's 13. He tells me what he sees. He's just in grade 8. And even grade 6, he was coming home asking. And he knows about my history, so we have a very open relationship. And he carries naloxone in his backpack and things like that. But like I'm able to talk to them, and he actually talks to his friends, so which is a good thing. But I really think we need to start, and these conversations have to start at home. Your parents, when you guys are younger, should have been, I believe anyway, they have to start at home.
Yeah, and we're really talking about prevention, and those conversations that are happening earlier in schools don't necessarily have to be all about substance use. It's about how you connect to your community, where your supports are, who do you see as your allies, or so you can build some resilience, because that's going to inoculate you against for all sorts of things, not just substance use, mental health challenges,
Depression.
yeah, all sorts of things. So yeah, the sooner we can be involved and support and develop coping mechanisms, because you're talking about trauma. When people are able to maybe reduce those experiences, they're going to be better off.
Or have the supports to help them through that. And I mean, everybody's so worried about it these days. Everybody's afraid to be open.
Yeah.
Well, I think some stereotypes come from the households that
Yeah,
you're in, especially
yeah.
being from Alberta and too much opinions as well. So if you're saying you want to be starting those conversations in middle schools, like getting people aware of what's going on in society at an early age,
I think that's one thing. I mean, with Isaiah passing in Souk, there was this much bigger conversation that happened with a lot of the parents at the middle school because he was attending that school. So I think that's a good start, right? The parents are seeing, and his mom is just like very vocal. But yeah, it's starting. But
well, here's an example. When I first started in this job, I was not allowed to go into a school and talk about naloxone. And unfortunately, there was a death of someone in Oak Bay, a student. And so parents would phone up, and I would do, I called them my Tupperware parties. I would go to homes where the parents would organize, and I would do naloxone training or talk about substances. And so now we have a requirement from the provincial government to say you need naloxone in schools. And naloxone is a reaction to a toxic drug event. We need to go further and have conversations about before this happens, because we're not going to nalox ourselves out of this.
No.
Okay, so we've got a couple more questions. Yeah.
Oh, it wasn't a question I wanted to ask you. When I was in grade 10, we had in a social sciences class, I can't remember his name, but he was like talking a lot in 2016 about the toxic drug crisis and all this stuff, and he was, I can't remember his name, really.
Is it? Come on.
I'm not saying that name.
Come on, I can't remember it.
I can't think. Is he bald?
No.
Oh.
Anyway, so
you're thinking of Guy.
Yeah.
I'm not.
like they put on like a whole like press conference thing that he did in my class talking about like
I wonder who it was.
you know, like the crisis and like how to end stigma and like how to help people. And I went to school in Langley, so
Okay.
like yeah, I don't know. It was just the one class. I don't know if they still do it, but it was a required class that everybody in my grade had to take.
Awesome.
It wasn't the party program where they try and scare you straight.
No, it was
That's
a little bit of like you know, there's people dying. You know,
Maybe Guy had hair back then.
beware. But it was also like, you know, here are resources. Like, please talk to adults, you know, and like, let's make sure our friends are okay.
Yeah.
Great. That's good. Yeah.
Yeah. I had a question, just kind of like about, I guess, this Tupperware thing.
Oh, okay. Yep.
Like, because it needs to start at home, I would assume just like going into schools and talking about drug use, I would assume that there's a lot of pushback from parents.
Yeah.
Because like it's inappropriate or they're too young to hear about this
Right.
or whatever.
You're going to give them the idea.
Yes,
Yeah.
exactly.
Yeah.
Yeah.
We're going to cause their drug use.
Like I think about my experience growing up. Like my dad works in harm reduction, so I kind of feel like I've always gotten a little bit more information on that than a lot of my friends. But I remember like a lot of my friends' moms were nurses, and still like anytime you go downtown shopping or something, like the reaction to houseless people is like, oh my gosh, something horrible is gonna happen to me. And I'm wondering if like there's like groups of parents or something that genuinely want to educate themselves and actually want to talk to their
Mom,
kids
stop
about
the
this and
harm.
stuff, because I feel as though like the only time I really hear about that is after child. And if there's any preemptive want for that.
Mom, stop the harm, maybe.
Yeah.
There's a group, I don't know how many of you have heard of Mom Stop the Harm. Most of the people that either volunteer or work in that organization have lost children to the toxic drug poisoning, and they've created a whole big organization, and they do amazing work, you know, and really educate as best they can.
Yeah. And they go into schools.
Yep, they do.
And they mothers and others, so it's not just moms.
Yep.
Yeah, I'm not sure. I'd say I'm kind of at the pointy end of things. The prevention end, I'm not so connected with. So I'm sure there are parents and there's resources out there, maybe more school counselors or alcohol and other resources that do those conversations or support parents, because there's absolutely resources online to support parents to have those conversations with their kids.
And I'm grateful that I can talk to my grandkids, like that I'm open and honest. And I mean, my grandson has lost his father and his mother, and his sister lost their mom recently, but you know, they understand, right? And they're talking to their friends, which I think is a great thing. The conversations are spreading, right? So, yeah. And I know my kids have the correct information, right? So,
yeah. A lot of stigma still.
Yeah. Fear. It's a stigma, but it's also fear of putting that idea. You're going to talk about it, your kid's going to go out and do drugs right away, right? Just because you're talking about it. And it's so
same with
true.
suicide.
Yeah.
Yes.
Could you talk some more about language and how the use of language combats stigma?
Okay, well, this is an old document. Like, if I call myself a drug addict, that's okay, because that's what I use, right? I'm talking about myself. But I wouldn't want anybody in this room to call, oh, that's a junkie on the street. That's someone who's suffering with substance use disorder. I don't know why it's okay for me to do it to myself, but I guess it just is, right? But
it's insider language.
Yeah.
You're reclaiming it.
Yeah. I remember years ago, I was walking up a street in Vancouver, on the mainland. I wasn't in Vancouver, but just because of my appearance, somebody drove by me and screamed crackhead. And I don't think I've ever been so hurt in my whole life, because at that time I was smoking a lot of crack. But for someone to say that to me, it was so hurtful and just drove me down even further than I already felt about myself, that I'm worse. So I think a lot of using language that's like, we have one up here and it's a little bit older, and I work for the group that developed this. We have to redo it. But there's different ways of talking about it. And I think it's just, how do I explain that? It's hurtful, and it can be really stigmatizing, and it can just push a person further down. So being polite and, using the language that doesn't offensive, I guess.
Mm-hmm. So what I would also say is language is a very easy way, especially if you're supporting someone, to create a relationship quickly. And if you're using stigmatizing language, it's a really quick way to turn someone off. And if you're thinking about what's the best way to do it, is always person first language. You want to say the person before whatever it might be.
That person has a name.
Yeah, and I feel like my background is more in suicide prevention and mental health, and then came over to the substance end of things.
Side.
Yeah. And mental health did this a lot. They would focus really on the person first. Like, Tracey's a schizophrenic. Tracey's living with schizophrenia. So it's just identifying and humanizing someone, and it just lands different. Language creates people's identities and worlds, and people will also walk around with internalized stigma. And so we just want to indicate that we're safe to talk to. We want to support someone, And by thinking about the language we're using, rather than using the shorthand, I mean, Beth gave an example about not being clean. You don't say clean?
Yeah, I don't say clean. I say I'm sober.
Yeah, because it could imply dirty. Yeah. You're going to add to that? Yeah. Completing. Yeah.
But yeah, so just like also just language as a means of not like maybe it's like a bad act
Or
criminalizing.
exactly. Yeah.
But when you're talking to somebody, why don't we just use, like, we don't have to put whatever that, like substance use, mental health, whatever. They have a name. They're a person. Just use their name. Like, maybe later, but address them who they are.
And I would hazard a guess that everyone in this room is more than one thing. Like, you have all sorts of strengths and interests, and especially if someone's looking to get support or help, you want to be more leaning into their strengths to support their growth or their whatever they're feeling challenged about. Yeah.
What are the sort of like options available to someone who feels like maybe outreach or you said meeting
Mm-hmm. Mm-hmm. So we have some outreach teams and nurses that work on outreach teams that could actually go connect with people. And so when people delay care, then they end up being brought in usually by an ambulance. So it's less about their choice and feeling compelled that they have to come in because their health is in a worse state. So this is why we advocate for actually having peers. So we have a peer who works in Campbell River Hospital, Andy Speck, and he's an Indigenous man, and he greets people as they come in, spends time, usually more than the medical staff can, providing bedside support. He actually acts as a really good translator, I would say, for the medical staff, and he can build a relationship much more quickly and spend time with that person than the medical staff can. So when you actually have people with lived experience actually in that environment, it supports a more welcoming environment.
Something that we've experienced lately is a lot of people, because they need their substances on a regular basis, are not particularly into emergency, are not coming in and not getting the help they need because they know they're going to be not be able to use their substances in the hospital. This is why it was such a disappointment that the OPS wasn't able to open, but we're doing new procedures to be able to try and minimize people's withdrawal, because none of you want to go through withdrawal. I mean, it's brutal, and I would not wish that on my worst enemy. I don't ever want, but yeah. So policy again, help make new things for people.
Mm-hmm. Yeah. Oh, great question. Yeah. Yeah. So I want to first say shout out for volunteering. I think it's a really important part of being a good citizen in your community, regardless of where you volunteer. Love it. I volunteer. So if you're looking for kind of harm reduction leaning organizations, AVI is a good place to volunteer. It's at 713 Johnson Street.
Yep.
Island Health has volunteer roles, so you can explore that.
Foundry.
The Foundry, it's a youth organization. That's a great place. I mean, if you wanted to just kind of see what's out there, you could go to Volunteer Victoria, and they would have a list of places. We were talking about Our Place. That's another place that would have volunteer. Kool-Aid. Kool-Aid be a great place.
Depending on where you live, there's places in the West Shore too, depending on, again, where you live.
Mm-hmm. Yeah, awesome. Any other curiosities?
Head scratches is Tracey's favorite.
Or like, what are you two talking about? That is nuts. No?
Mm.
Yeah, I feel more hopeful, and I feel like we still have a long way to go.
Mhm.
Beth and I have constant disagreements, um, and I've seen the policy actually be used to, as I gave it an example, change the way other systems might be considering documents. Um, yeah, I think what we're really trying to do is change culture, and that is a slow drip. That does not happen fast.
Yeah. I think that in acute care, I would say there's been some big like changes. I think for me personally, I think acute care, but emergency departments, not so much. But I think a lot of it isn't so much the policy, but I think it's just low staffing, just frustration that they can't do the things I think that's a big thing, is that frustration of not being able to support better.
Yeah, you're touching on something I think we should amplify a bit more. Is like people go into healthcare because they want to help.
Yeah.
They don't want to hurt. And when people are under resourced, sometimes people get impatient, have to stay overtime. There's all sorts of challenges that contribute to not a great environment and wears on people's patience.
People coming in too, like it's there's a lot of wear and tear on that, but there's also sitting in an emergency department for hours on end, being ignored and getting frustrated, and then and rightly so, we all get frustrated, but then things tend to escalate, right?
Mm-hmm.
And it's not always Island Health's fault. I'd like to say that it's not always our fault, but yeah.
And since the policy, our little team of 5 have been doing a lot more engagement because we've got more resources and people are interested. So a colleague of ours, Jenna, took how many people have we actually trained? What have we done? And
Oh my God, it was crazy.
Like 4,000 people in 8 months.
Yeah. We're busy.
Yeah. So yeah. Yeah.
Safe supply.
Oh, here we go.
Your experience with this policy development, give lessons towards how do we move towards safe supply?
Oh boy. I as we were driving here, I said to Beth, I wonder if someone's going to ask us if we were in charge, what would we do? We need more options for people, and safe supply for me is another option. Really, what's killing people is the unregulated supply. And it's complex. Yes, go ahead, Beth.
I mean, we need housing too. It's really hard that if you don't have somewhere to live, how is anybody how are you going to ask for things? Like I don't know how to explain it, but being unhoused, there's just not a lot of hope, I guess you feel. And we need housing for people. I don't care what anybody says. All of Pandora Street has not been offered housing, right? That's just a line that somebody said one time, and it's not true. But it's hard to feel good about yourself and think that anybody else is going to want to help you when you can't, when you don't have a phone, you don't have a house, you don't have clean clothes. Like, I don't know how to explain it. It just feels you're not going to ask for help.
Yeah, you're busy taking
care of yourself. I mean, imagine not being able to you go into a restaurant and just because of the way you look, they won't even let you use a bathroom. Like, it's just crazy. Like, it's so hard. And we put such judgment, and we automatically think because someone's unhoused, they're using substances, and that's not always necessarily true.
Yeah. And I think the policy helps set the stage for other harm reduction interventions. So to me, that's a regulated supply is another intervention.
I believe in safe supply so much. I think that we would save so many lives if we had a safer supply. But our government's just not there yet.
We have a court case right now.
Yeah.
With the drug
Dolph, yeah.
Front,
yep.
Fighting because they provided tested drugs
yeah.
they got from the internet. And that's being challenged. And I worked with Victoria Cannabis Buyers Club and Pet Smith. And 10 years ago or longer, we were providing cannabis and went through a similar journey with the courts. Went to the Supreme Court of Canada.
Mm-hmm.
And as you probably saw around, there were a lot of copycats that came after we started our journey through the courts. Lots of other clubs emerged. They were all selling cannabis. Everybody was sort of protected by this court process that we were involved with.
Yeah.
Mm-hmm.
I'm just curious if that's something you might think could happen with Safe Supply.
I am.
Successful,
Yeah.
Would Island Health have problems with a similar thing, sort of breakouts, community organizations, doing this sort of stuff like Gulf?
A few things to add. So we have a newer chief medical health officer, Dr. Reka Gufferson. And when she first came, she was talking about compassion clubs, like Dolph doing. So we've got some strong leadership in Island Health that would be, I think, supportive. The challenge is we've got federal laws that get in the way, as you know. And so I happened to attend Dolph's hearing. And so as soon as they were found guilty, they submitted a charter challenge. So we have to do something about the federal laws to be able to provide better care for people. And we continue to stigmatize people when we have laws that say you are a criminal. This is criminal what you're doing. So we've got a lot of barriers in front of us, and so federal laws need to change for us to be able to move forward, as you would have experienced with cannabis.
And there is people out there fighting for that, but we're a ways off yet.
Yeah, that's not going to be a quick fix.
No,
but it will be a significant one. And that's why Insight got to stay open, because they went all the way to the Supreme Court, and it was recognized as a healthcare service.
Because it saves lives. I don't think that anybody in any kind of overdose prevention site has lost their life.
Yeah.
I don't think we've ever had one death.
And just to, back to Dolph, they had a federal exemption for UPNHS around the substances, so they'd be able to test them. They had an exemption for being status for an OPS, and where there was no exemption because they just didn't have one, is they were selling it, and they were selling it at cost to save people's lives, but that broke a federal law, and there was no provincial protection for that.
And it's just, in a way, it's so sad because they were so open about what they were doing. Like, they never hid it. They were saving lives.
They were endorsed by
by the police.
Yeah, they actually did a presentation to Vancouver PD about what they were doing. So the police knew. The health authority, Vancouver Coastal, knew. And then an article comes out that rubbed a politician the wrong way. So it felt like it was waving it in front of their noses, saying, this is what we're doing. So complaints happened.
Yeah.
Oh, yeah, covering lots of ground tonight. Okay, any other questions or
These have been really
comments?
great questions, by the way.
Yeah, loving
Thank you.
Yeah, keep going.
The other one is cannabis substitution.
Mm-hmm.
So we have Solid.
Yeah.
Solid is being connected to UVic here.
Mm-hmm.
Many years of study and benefits of that program. But yet it's still it exists sort of outside of the system. Would there be a policy process like you've done that would benefit cannabis substitution?
I don't know if Island Health would actually bring it underneath into their realm, but Solid does have support from our medical health officer because they need certain exemptions, so they know what's happening there. Bernie Pauley and Karen Urbanowski have done research on Solid's cannabis substitution program, which is posted. I mean, harm reduction is one of the most well-researched approaches. And so lots of stuff that's evidence-based, but it's so controversial.
Yeah.
And it's like changing the way people might look at it that hold power. And then there's such vitriol in the community around substance use and those people, which makes it really difficult for politicians to support the work. It's frustrating.
I will never understand cannabis. Like, I mean, I've done all the drugs and I would never, like, for me, cannabis would never have replaced anything I ever did. I will never understand. For some people it works. And again, that's a harm reduction measure, right? But it always that one does confuse me, because fentanyl, opioids, like heroin, because I was one of the lucky ones, I was able to do heroin.
When it was available.
When it was available. I don't know how cannabis compares. I'll be honest.
At the Victoria Cannabis Buyers Club, we have a steady stream of people who have injuries, who have found themselves on the street using street drugs. And cannabis, for them, we provide very high dose edibles. That's our thing. Like, I went to court for edibles when the government said you could only smoke cannabis. Sort of an example of how ridiculously the approach of the government has been to this subject. But they help them sleep, and it can help with pain.
Yeah.
Somebody's using opiates to help with pain.
Yeah. And I think what you two have beautifully illustrated is this is why we need a spectrum of supports and interventions, because we're all unique individuals, and what might work for Beth won't work for me, and I need something different. So often I ask people to think about, I've had family members who have gone through cancer treatment, and they find out what kind of cancer it is, and they find the right medication. So it's individualized treatment. We can't just say it's one way. Here's your option. Go for it, because this is the right way. It's not going to benefit people. It needs to be a full spectrum of care and service for people to be able to decide what's going to work for them.
A lot of things. I mean, we need more treatment beds. We need, like, when people want to go to detox, they should be able to go to detox right now in the moment. We can't provide that, right? Like, there's so many things that would add up, but to, you know, saving lives, but we don't have enough.
In the debate, I hear recently more about involuntary treatment. What is your perspective on that?
It's wrong. It's 100. That's just my opinion. It is so wrong. But let me put it on back. If it was one of my children, I might feel differently. But for someone else, I think anybody being forced to do something that they don't want to do is wrong. But as a mother, if I'd had the opportunity, I mean, I have a son on the downtown east side. He's been there for 15 plus years. And like I said earlier, I lost my daughter in August to a drug poisoning. Maybe given the opportunity, I might want to, but that's just, I struggle with that because I don't believe in it. I don't think it's right to force anybody. But as a mom, maybe I would force my own children if I could.
Yeah, I'd like to see investments in beds, services to make them more readily available. And I've done a lot of thinking about involuntary treatment, and there's people that I have supported when I worked in mental health, and they had a serious and persistent mental health concern. And when they were well on medication, they would say, I need that certification. So when I'm not well, I need, because I know I'm not going to do well, and I need to be hospitalized. What's not clear to me is what involuntary treatment looks like. Yeah. I know what it looks like for people who have mental health concerns. You're entitled to a review panel, so you can challenge your involuntary treatment. But I'm not clear, and I'm uncomfortable with how it's described for people who use substances.
Yeah, and I think that's, like you said, it's very different for substances versus, because a lot of people, at least people I've come in contact with, think that the two go hand in hand. And yes, sometimes they do, but they're also two very separate entities, right? Substance use, mental health. And I think, yeah, just again, it's wrong. It's just wrong.
You had a question. You had your hand up. You were being very patient.
Oh, I was just curious about policing rolled out players, and I am thinking about like sweeps.
Oh boy.
Oh boy.
Yeah.
I disagree. I've seen sweeps on Pandora. It's bad. Imagine all your personal possessions being gone. But it's not doing any good. It's wasting money because the people on Pandora are moved and they're right back a couple hours later and they're doing it again. But taking their possessions and dumping, like they set up massive dumpsters on Pandora, and if you're not in your tent, your stuff is gone. Yeah, it's a waste of money, and it's not going to change anything. It's just going to push them to different people to different them. I said it, and I don't mean it that way, but
we can do better.
Yeah, we can
do better, and we can use that money in a better way. Yeah.
Do you like see I guess the government's take on this? Because like I'm from Vancouver, and I remember when Thompson elected, a lot of like this kind of running stuff was about what to do about these cases and stuff. And I mean, all he's really done is remove Tent City and kind of displace people who are already displaced,
Yeah.
and really just have like only out for the rich people of Vancouver. And I think that I've seen that all over Canada, and especially because I think of Vancouver as a very like progressive city. That was upsetting to see because it kind of like I feel like it's a bit of a step back, and I wonder if there's been any kind of push for the government to actually really get involved to help people, or is it all just like guys who just put your efforts in and hope the government?
There are a lot of people that are, I'd say, pushing and leveraging government to make changes. We have Doctors for Safe Supply, or it was policy. So there's people organizing to do that, and I'd even go farther and say globally, we're in a challenge, and I've been at this for a while, and I've seen a swinging of the pendulum in a direction makes me quite sad and fearful.
Yeah.
And then when, if we want to talk about Venezuela and how that was done, really, again, people who use substances being the leverage for that to transpire is just disgusting. And yeah, I mean, we're not in a good place. I'm quite concerned. Yeah, and actually, the harm reduction policy, if I was to start that 8 months ago, we never would have got it passed now.
No, we wouldn't.
Even in our health authority, when it happened.
I always say, and I don't know if I'm right or wrong, but I always say that you March 1 like a prime minister, like in Canada anyway, someone who's really high up there, just one of them lost a child to the toxic drug supply. I wonder how much that would change, because they have the voices, they have the power to change these things, but they just pussyfoot around and do a little bit here and a little bit there. It never changes anything, right?
I don't even know about that, because we've had a prime minister whose father
That's true.
completed
You're right.
suicide.
You're right. Yep.
Was a conservative.
Don't say it out loud.
Yeah. So I one thing that gave me great hope is I went to a harm reduction conference in Bogota recently, and being around all these people around the world working towards social justice and making change and making significant policy change, embedding people with lived and living experience everywhere. I literally wept. I cried after day one, because I'm like, this is incredible. Yeah. So this work can be really isolating, and finding people that champion this and being around folks that have hope. So I'd like to think it's actually kind of shared hope. When I'm not having it, I count on Beth to have that hope. So yeah, so just being around like-minded people and watching the struggles and the good work that they're doing helps. So I'm not giving up entirely. Oh boy, yeah.
I read something a few months ago, I think in the Times columnist, about the center that's opening in Surrey, or that they're building in Surrey, or they were talking about in Surrey. And in the thing, it mentioned that like the reason for it was because how many overdoses people have had, their brains are damaged, and like that they aren't able to comprehend that they need care. And like, is that how the healthcare is seeing overdoses and people deciding not to use or to use and to lose their life?
There's definitely been some concerns about people with repeated overdoses and anoxic brain injury. I mean, a lack of oxygen does cause damage to the brain, but how many hockey players and football players have had concussions over and over again, and we don't seem too concerned about their mental health. So, yeah.
We are.
Yeah, we are, but you know what I'm saying? Like,
yeah.
trying to...
So that's not something that, like, that whoever was printed that just popped out their ass.
Well, there is some facilities being up and coming,
yeah.
for sure. But again, it's like trying to say the Mental Health Act is for mental health problems, not for people who use substances. But if we start linking it together, like, it's just a gong show. And my fear is if we start forcing people who use substances into treatment that don't want to be there, they're going to come out. They're going to go right back to old habits. And now we've got the death rate skyrocketing again because their tolerance is so low. They use once and they'll probably pass away, right? Mm-hmm. So, yeah, it's really scary.
And it is not untrue. People who experience multiple overdoses, that does happen, put themselves at risk for brain injury and other challenges. But that's not a reason to create involuntary care. And with all that invested, would you not want to create resources that people want to engage in rather than force people? Anyhow.
In the article, they also mentioned that it was like some as an option instead of someone, like, if they're in prison or is using go to involuntary care.
Yeah, they already do that.
Yeah.
I mean,
oh, yeah.
courts already have diversion programs. That's not new. Yeah, but I mean, show me the evidence that involuntary treatment actually works for people.
Well, Daniel Vito says it does.
Yeah, show me the evidence.
Yeah, exactly, which he doesn't have, but he's trying to get the evidence.
Okay.
With the pendulum swing away from social services and things like that, what's something that someone who's not in policymaking or any of these groups, what's something that, like, someone like us can do?
Oh, great question. Yeah.
Go ahead.
I'd say we need to leverage our government to do different things. So any opportunity to support change, I would do that. So reaching out to your MP,
MLA,
and MLA.
Yeah.
I also think small things make a big difference. So having conversations with people, if you hear something stigmatizing and you feel comfortable enough to actually speak up and say something, I would. Yeah.
And just remember, people on Pandora are people. And when you're down there, don't be afraid. Just, like, smile. Hey, I tell you, you'll get some really great stories. If you start a conversation, you might have to back away, but you'll get some really great conversation. It's nothing to be afraid of.
Mike, you got any suggestions?
This is your class.
Well,
you're the teacher.
I'd say it's the students' class, and that Mike's for them.
Yeah, that's true. Yeah.
We'll discuss this question.
Oh, okay. All right. Okay.
Okay, but answer the question, I think. So you're the guest speaker. I feel weird.
This is shared.
I
I
think
think I have.
one
I
way
think I know.
to be an ally to peers, organize with you think organizing with other students is useful. And it's not, you don't have to be that it's not useful. You might have a very small effect nonetheless. So I think even the organizing that people did on campus around to over those forms, that did do something because that did help apply pressure on the university.
Yeah. It also raised a lot of awareness.
Yeah.
And actually, yeah, UVic did change their policy to be less punitive and more inviting. And so anytime we can shift policy to be less punitive or less coercive and more focused on support and engagement, we're doing better.
Yeah, I was on that research map.
Awesome.
So I think organizing that's the short answer. But I think some people are hesitant to organize because they're afraid of being accused of being an activist.
Yeah.
Or being, naive that they think people might be a bit worried about actually doing something because I don't think actually doing something is that common within every society. It's seen as like a weird thing.
Well,
Or someone might call you a nosy neighbor.
totally.
There's all of this pejorative stuff about people who are activists.
And if you would like this idea of this, like I've never written a regional policy before, and I'm a people person. I'm not a policy person. And I had a big division between. I support the people. I don't write these policies, but really, the people person need to get involved. And I had to think that this happened shocks me a little. But just being persistent.
And you guys are a whole new generation.
Hope.
You're our future leaders. Do good.
Yeah. Okay.
Or did you want to?
Well, maybe what I'll do is I'll just quickly go through this. So I mentioned that we do toxic drug advisories, and so when we send out those messages or advisories, you can actually get them to your cell phone. You can just grab one of these cards and you text join to this number, and an advisory will land right in your phone, and it's linked to other resources, so you would see that. So sometimes we send those out. Beth and I sit on a committee and we review data every day about what's happening in different communities.
We also get coroner data once a week, and there's usually